This is part of a series of supplemental, self-guided presentations that you can view at your leisure to get more information about topics of interest to you. I am Larry Santaramo, nurse practitioner in the Mental Health Primary Care Clinic at Durham, VA. In this presentation, I'm going to talk about managing your veterans' loved ones' medications. In this presentation, we will identify strategies for coordinating medications with your veterans provider, keeping track of and organizing your veterans' medications, addressing any problems with medications. I'd like to first talk about when you meet with your veterans' primary care provider. Always bring all medications or a complete list including the name of the medication, dosage, and expiration date to your veterans provider's appointments. Make sure to include all prescription medications, whether prescribed by this particular doctor or not. Remember to bring any OTC or over-the-counter medications such as allergy, cold, and flu, or heartburn medicines. Also include any herbal and natural medications like melatonin and the like. This helps to make sure that you and your provider start out on the same page, with the doctor knowing all the medications your veteran is taking and that all medications are up to date. You and your veteran's doctor can check that your veteran is taking the appropriate dosages of his or her medications. You can check for out-of-date or expired medications, and the doctor can confirm and answer any questions as to why your veteran is taking this or these medications. Using a medication log can be a useful tool in not only keeping track of the medications that your veteran may be taking, but also in having a conversation with your veteran's care provider about the medications he or she is taking. Here is an example of a medication log. It is available at www.caregiver.va.gov, or you can use it as a guide to create your own. Note the section marked Physicians, where there is space to record the provider's name and contact information. It may be helpful to include other important medication-related numbers on this page, such as the number to the VA pharmacy, your PAC team social worker, or poison control. In many cases, the best person to tell you about how the medications are working, if there are any problems or concerns, is your veteran. Start by having a conversation with your veteran loved one about the medications he or she is taking. Do they know what they are taking and why? How do they feel when they take the medications? Do they feel as if the medication is helping? Are they still having symptoms? Are they experiencing side effects to the medication? Is the pill too big or too difficult to swallow? Share your observations with your veteran. If you notice that they are groggy or out of it, or if the medication gets them antsy or agitated, discuss it with them. Let them know if you feel the medication is helping, or if you've noticed any side effects. Let your veteran know that you have questions about the medicines and would like to bring it up with their healthcare provider. Let your veteran know what the questions are and ask them how they would feel if you brought these questions to the next scheduled appointment. Communicating about medications. Ask questions. Why is my veteran taking this medication? Will it interact with any other medications? What kind of side effects might my veteran experience? How will we know if it's working? How long will my veteran need to take this medication? Voice concerns. Why does my veteran need this medication? Are there any risks to taking this medication? How much will this medication cost? Are there cheaper alternatives? Organizing your medications. Use a pill box. They range from simple to complex. Use a chart to mark time and frequency of dosages. Keep them in a safe place, out of the reach of children or adults with memory or cognitive impairments. Use child-proof caps. Keep them in a cool, dry area. Near the shower is not a good idea. Taking medications, especially when there are a number of them. They can be prescribed to take at different times or throughout the day and can get complicated. Some have found that developing a chart of what medication needs to be taken when, as well as whether the medicine needs to be taken with or without food, can be helpful in keeping track of complicated medication routines. Others use pill boxes from the simple to complex. They are inexpensive and a great way to organize medications. Pill boxes can be simple, with one compartment for each day of the week, or to more complex, with multiple compartments for each day, representing different times of the day. You may also consider attaching the taking of medicine to an already established routine, such as morning coffee, mealtime, or nighttime teeth brushing. Equally important is that medications should be taken exactly as prescribed. There are some medications that have risks associated with stopping abruptly. Please talk with your veteran loved one about communicating any desire to stop taking a particular medication with his or her prescribing clinician before they discontinue the medication. Whether you have children or teenagers who visit or live in the home, or if you are caring for a veteran with memory or cognitive challenges, it is important to keep medications out of reach or locked up for safety. Brightly colored pills and liquids may look interesting to children. Young children explore the world with their mouths. Slightly older children can mistake medications for candy. Some medications can be used outside of the parameters of their prescription. Some may wish to abuse a prescription intended to treat another's pain or anxiety. It is important to keep potentially abusable medications under lock and key if there are any concerns of misuse. If your veteran has memory or cognitive impairment, he or she may forget that they have to take a particular medication, even with the aid of a pill organizer, and take too much of a medication. Too much of some medications can be extremely harmful or even fatal. It is important to have a conversation about potential dangers of a medication with the prescribing clinician or the pharmacist. Consider having your local poison control hotline number handy. Set it on your cell phone or post it near the home phone in the event of an unfortunate incident. It is also important to keep an eye on the expiration date of the medications in your home, including the over-the-counter medications and herbal supplements you or your loved one may be taking. Expired medications can be less effective in treating the symptoms they are intended to address, or can even make you sick if you take them. Talk with your veteran's primary care provider about the impact that alcohol or other drugs may have on the prescription medications your veteran is taking. It is important to remember that alcohol or other drugs can have a dangerous effect on prescription medications. Alcohol can amplify or nullify the effects of prescription medications. Alcohol is a depressant. If you're currently managing symptoms of depression or other mental health issues, alcohol use is strongly discouraged. Alcohol is not good for persons with diabetes or heart conditions. Alcohol use can also be habit-forming. As well, recreational drugs can amplify or nullify the effects of prescription medications. Illegal drugs are not regulated. You can never be certain of the potency or what you are taking, or even if it is what you think it is. As such, you cannot reliably predict how they will affect you. Prescription drugs taken outside of the parameters of their prescription can be dangerous and even fatal. Combining some drugs with alcohol can also be deadly. If you are currently managing symptoms of anxiety, depression, or other mental health issues, illegal drug use is strongly discouraged. Illegal drugs are not good for you. They can exacerbate existing health problems. They are dangerous and unpredictable. They are illegal and can result in jail time. Drug use can be habit-forming. If you or your veteran loved one are using drugs or alcohol, it is important to have an honest and open talk with your doctor about safer alternatives. Remember, the doctor or provider is not there to judge. He or she is there to ensure you or your veteran loved one is getting the best care in support of the patient's best interest and overall health and well-being. Don't be afraid to talk openly with the doctor about your veteran loved one. Work with your veteran and your veteran's VA healthcare team to help manage medications. Managing prescriptions. Has your veteran run out of medicine? Call your veteran's PAC team and speak with the nurse or provider to verify whether the veteran is still supposed to be taking this particular medication. Ask your PAC team provider how best to handle a medication refill. Call a pharmacy to request a refill. If the veteran cannot be without this medication even for a brief time, bring your veteran to the local VA emergency room to be evaluated by a physician. How to avoid running out of medicine. Mail back the return slip as soon as your veteran's medication arrives by mail. Place a phone order for medication refill as soon as the medication arrives. Use My Healthy Vet to order medication refills. Be sure to do this when veteran has at least 10 days worth of medication left. Thank you for taking the time to view this presentation. If you have any questions or are in need of some resources, please reach out to your local Caregiver Support Coordinator or call the VA National Caregiver Support Line at 1-855-260-3274. Be kind to you and take good care.